wellness revolution starts now.
Welcome to the program. My name is Bryana Gregory, Pharmacist and Physician Liaison with Physicians Preference Pharmacy. Today, we're going to talk about a very hot topic of parasites. Everyone's asking about parasites. How do I know if I have parasites? What do I do to treat for parasites? Which medications do I use? So we're going to cover some of those items today. And the purpose of this episode is to discuss two of our compounds that we offer at Physicians Preference Pharmacy, both ivermectin and mebendazole, which are classic antiparasitic treatments, and when they come into play, when we should use them. We're going to talk about dosing and the nuances between the two. So just as an introduction, I want to start at a ground level. We have to talk about what parasites are. So parasites, usually we think about worms, but that's not all that we're trying to address with antiparasitic treatment. So parasites are an organism. They're an organism that lives on another organism, which we refer to as the host. And that parasite that lives on the host also gains benefit from living on that host organism. As a result of benefiting, it usually strips the host of something that it needs to live a high quality of life, like nutrition, like proteins, like blood, like tissues. So there are many complications that can happen down the line if we suffer from either acute or chronic parasitic infection. So you may not think this, but I think that this is probably an underestimation, and it's very hard to tell what the actual figures are. But we believe that more than 1/4 of the global population currently has parasites, which deserves treatment. So the problem, if we become infected with parasites again, is that we can have chronic complications. We can be stripped of our nutrients, and that can lead to chronic health conditions. Some people may experience intestinal discomfort, diarrhea, loss of iron, headaches, inflammation, autoimmune disease. So it is believed too that the female adult worm, and we're going to talk about what hits on an adult worm and what hits on the larvae or the eggs of the worms as far as how medications go, but it's believed that the female adult worm is able to actually manipulate the immunoregulatory environment, which is a fancy way of saying the immune system. We know that God has given us an incredible immune system, so we want to be sure that anything that tries to intentionally hijack it, that we can protect it from that. So parasites are still a major health problem worldwide. We tend to think of parasites being an issue in third world countries, which they are when we are having consumption of unclean water, crowded, busy houses, people kind of living on top of each other. So some of these environments, we certainly see that they do routine parasitic sweeps, almost as prevention. One of the tricky things about parasites is it's very hard to detect them and it's very hard to test for them. So oftentimes when people go to their physician or they come to the pharmacy, they may have taken a parasite test and actually showed up negative, but we believe that there are many false negatives, meaning that someone may have parasites active in them, but they do not show up on a test. So at Physicians Preference Pharmacy, we are a compounding pharmacy, and I want to peel back the layers again and start from the beginning. Let's talk about what compounding is and how does it have a role in antiparasitic treatment. So pharmacy compounding is when we go back and we think of the old apothecary days when we would make medications from scratch. So we're mixing the ingredients here in our laboratories, which becomes very important for certain types of people. So think about children, think about hypersensitive individuals, think about patients that are very sensitive to certain active or inactive ingredients in the compound. We have the ability to tailor the dose and also to remove some of those inactive ingredients that tend to be present in the commercially available product. I'll give you an example. So typically when we compound a medication for somebody, it's because we need to change the dosage form. Maybe instead of a tablet, we make a liquid. Maybe we make a cream instead. We're always taking into account where the medication needs to go, how are we going to get it there, And how are we going to do that with minimal side effects? So when we talk about prometrium, which is a commercially available type of progesterone, I have a list here of the ingredients that are present in this commercially available product that some people may not tolerate. So peanut oil, gelatin, glycerin, lecithin, titanium dioxide, which is something we definitely do not want in there, yellow dye, and red dye number 40. So many people do not tolerate these types of ingredients, and this is an opportunity for us to customize a formulation like that to take out those ingredients to minimize side effects and enhance efficacy and purity of the product. That being said, we do the same thing with mebendazole, and we do the same thing with ivermectin. So let's talk about those. As a pharmacist, I love to understand where the medications came from, what their history is, and really how that plays a role in how we use them today. So these are not new kids on the block. We've been using ivermectin and mebendazole since roughly the 1970s. A brief history on ivermectin. So in the 1970s, a Japanese microbiologist isolated a bacterium from the soil called Streptomyces avermitilis, and it came from a soil sample. And when he isolated that, he took cultures from that soil sample that were found to produce a compound called avermectins. Avermectins were effective against parasitic worms. And oftentimes we will see in many drugs that we compound in the modern world today were initially isolated from the soil. We think about the soil as also its own ecosystem. So everyone has to play nicely. The worms, the bugs, and all the other creatures that are living there, it truthfully is no different in how it would work in the body. So fast forward to today, those avermectins have been reworked to a derivative called ivermectin. Now, ivermectin, of course, was then put down two routes of research, one towards livestock and pets, think about giving it for heartworm for your dog, for example, and then also as an antiparasitic, or what some people call a dewormer for humans. So to talk about what ivermectin does, we can use it for internal parasitic infections or external parasitic infections. Internal parasitic infections would cover common indications like river blindness, whereas external parasitic infections would require a topical form of ivermectin to be placed on the skin to address topical parasites like head lice and scabies. So ivermectin largely addresses the larvae, which is similar to the egg stage, and early developmental stages that take place in the tissues. So benefits of compounded ivermectin are that we can tailor the dosage. When we dose ivermectin and when your doctor writes you a prescription for ivermectin, it is going to be weight-based, meaning that someone that weighs 150 pounds is going to receive a different dose than someone weighs 175 pounds. Here is my public service announcement. Do not share your ivermectin with family members. Also, a different delivery form. So we have both oral capsules as well as topical creams that contain ivermectin at physician's preference pharmacy. And additionally, like I mentioned, we have the opportunity to lower the incidence of side effects because we're taking out potentially bothersome ingredients in those medications and being sure that we retain the purity and the efficacy of the compound. For example, in our compounded ivermectin, we make sure that it does not contain cornstarch or BHA, which is a common preservative that is thought to be carcinogenic or cancer-causing. That is largely present in many foods, which are processed, many cosmetic products, as well as many medications. So ours do not have those ingredients in them. All right, so let's talk about mebendazole, our second drug up for antiparasitic use. So a brief history on mebendazole, also roughly discovered in the 1970s, is classified as something called a benzimidazole, which was introduced for human use largely to treat gastrointestinal parasitic infections caused by roundworms, hookworms, and whipworms. So we're talking about the live, fully developed worm. Mebendazole largely addresses the adult worms that are most commonly found in the intestine, and we have seen over the past few years that there has certainly been an increased desire for compounded mebendazole, and I'm going to tell you why. So mebendazole, as an active drug ingredient, comes in different polymorph forms. And before we started compounding mebendazole, I had to look into what polymorphs meant. That's not something I was taught in pharmacy school. So polymorphs means a crystallization form. If you go down to your retail pharmacy and you get a prescription for mebendazole filled, what they're filling for you is mebendazole. That's all it's going to say. But it is a combination of polymorphs A, B, and C. So they just crystallize a little bit differently. There's a blend of it in that product. Not good, not bad. However, if we want to be sure that the mebendazole is making it into the brain, especially if we have parasitic infection in the brain, then we need to be sure that it's getting there. Polymorph C, which is the type that we compound at Physician's Preference Pharmacy, it's a pure polymorph C compound, will get into the brain tissue because it is designed to get there. We still do get systemic absorption, meaning that it will go throughout the body and address parasitic infections elsewhere. This is one of the reasons for the increased demand of compounded mebendazole. Additionally, we can customize the strength. So although it may not be exactly weight-based dosed, what you're going to give a child is much different than what you would give a larger adult. Additionally, some of the reasons why we might compound products is that people have sensitivities to active, inactive ingredients, dyes, starches, excess preservatives. And some of these doses, again, are intended to be higher for those people that weigh more or a mature adult versus a younger child that also may struggle from parasitic infection and needs a much lower dose of that drug. Something that is very relevant right now and current in our legislature is getting ivermectin over the counter, what we refer to as an OTC drug. So if you walk into a pharmacy, you can pick up Advil, you can pick up a fungal cream, and also now you can walk into a pharmacy and in some states, pick ivermectin up over the counter. In some, it's what we refer to as a behind-the-counter medication, which means that you do have to consult with a pharmacist, but a prescription is not required. As a pharmacist, I have a few concerns with this. Let me preface it by saying that I am all for increasing patient access to any drug that is important for whatever condition that they might have. However, just because products are over the counter does not mean that it necessarily comes with a manual or a manual that people even read before they take it. So there's a couple concerns that I do have with this. There are a few states that have now put ivermectin over the counter, and this is something, again, that is pending in legislation for other different states right now. Arkansas, Idaho, Louisiana, and Tennessee are a few examples where ivermectin has already gone live over the counter. First concern I have with this is dosing. We do know that ivermectin is a powerful anti-inflammatory. It is labeled as an antihelminthic or an anti-wormer or a deworming drug. That's what we're talking about today. It's indicated for parasites. But how do you know that you're getting the right dose? You may be underdosing or you may be overdosing. And the problem with that is you may not be getting the most efficacious benefit from using the drug. We can talk about how well the drug works all day, but dosing is crucial. So number one concern I have with that is the dosing right? Another thing to keep in mind is that when we can customize this compounded product for you, let's say of ivermectin, again, we can put the entire compound or the entire dose into one capsule. If the standard 3 milligram tablet is what they continue to put over the counter in these states, you may have to take several tablets just to get the total dose that you need in every single dose that you take. Second concern I have are drug-drug interactions. One of our responsibilities as pharmacists when we fill your prescriptions is to screen for what we call drug-drug interactions, which is why we ask for a list of your current prescriptions, supplements, so that we know if you have any allergies, if any of those drugs or medications or supplements are competing, if by taking one and another it makes the other less efficacious. That's our job. So we want to be sure that as our responsibility to screen for that we can provide you with that service to be sure that if you're taking a medication like ivermectin, that it's not being inhibited or amplified by anything else on your drug or supplementation regimen. So you've probably been thinking, how do I know if I have parasites? I may have some persistent symptoms. Does that mean I have parasites? Some common symptoms of parasitic infection, again, include weight loss, anemia, diarrhea, constipation, so a lot of gastrointestinal issues, chronic fatigue, abdominal pain, and even increased intracranial pressure. So that's in the head. Again, parasites, they don't discriminate where they go. They can go anywhere. Additionally, when we're talking about ivermectin or mebendazole that comes from Physician's Preference Pharmacy, because it is a compounded product, it is available by prescription only. And again, we do recommend working under the supervision of a physician to write you the personalized prescription for this antiparasitic medication, so we be sure that we get it right and that we can dispense a pure product to you. This way, again, we can ensure the purity, the potency, and the appropriate dosage under your doctor's care. So if you think that you're experiencing any of those symptoms, please consult with your physician. If you have any questions for us, for myself, or any pharmacist at Physician's Preference Pharmacy, please do not hesitate to reach out to us. You can reach us at 281-828-9088, and it would be certainly our privilege to serve you. Physician's Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.